a new Congress endorsement.
By not taking corporate PAC or lobby money, she's showing that she will only be accountable to us.
And we could really use a progressive voice from Iowa in the Senate.
She supports things like the Green New Deal and the Clean Air and Water Act and doesn't take any money from lobbyists. Please join me in voting for my future by voting for Kimberly by mail. Thank you.
So I'm just going to go down the line and ask you to introduce yourself. We only got roughly an hour for this, and there's a lot of you, which is amazing. I mean, let's try to keep our intros as brief as we can so we can get to the meat of what we're here to discuss. So have we started live streaming, guys? Or are we recording? Have we started recording?
Yes, I've already begun recording.
Perfect. Okay. So hello, everyone. I'm Kimberly Graham, candidate for United States Senate here in Iowa. Today is our, I think, last of these series that we're doing via Zoom since we can't be out campaigning in person with everybody, unfortunately. And today, one of our amazing volunteers, Aisha, has done this fantastic pulling together of people from literally all over the earth to discuss the COVID-19 response in different nations. We, of course, here living in the U.S., know, unfortunately, all too well what our state level, county level, federal level responses have been to this pandemic. And so we are here to talk about how other nations are handling it from any and every aspect that these particular panelists know about. Everything from what public officials have said throughout this pandemic to what public officials do, e.g., are they wearing masks in public or not themselves, to how has the manufacturing of PPE been ramped up or has it not? What are they doing about childcare? Are childcare centers still open? Are they closing in droves like here in the U.S.? So now our childcare crisis has now gone to a full-blown disaster. What's their medical system like? What kind of medicine do they have? Which could be a whole other show, but we'll try to keep that part small. And then how is the government helping individuals financially or not? And what does that support look like? And how does it dovetail with unemployment benefits? Do you get one and not the other? Does everybody just get a lump amount? What are they doing? What's happening? So I'm just going to go down the list here and have everybody briefly introduce themselves, and then we'll just get into discussion. I don't know why my weird face is in the middle of the screen, but it is. Anyway, so Lauren, thank you. Welcome for being here. Where are you from? What nation are you living in? And what, what's happening in your neck of the woods?
So my name is Lauren. I'm an American, but I've been living in Japan for over 25 years. I live in Tokyo. I have been active in Democrats Abroad for a very long time, helping register American voters overseas. Awesome. And I work in the travel industry, which, as everyone knows, has been greatly affected by all of this everywhere. But and my family still lives in the U.S., so I'm very closely watching what's going on with you guys, and it's quite interesting to see the comparison here. I'm very proud to be asked to be on this, and we're big supporters for you, Kimberly. I hope you have an excellent last few weeks before this, before the primary, and then you're headed into an amazing election season. So
hopefully, yeah, we have 3 days left until this primary is over. So we'll see what happens. It's kind of one of those AOC situations, like she didn't have any money for polling. We don't either. So we have absolutely no idea how we're doing. I mean, we only sort of have anecdotal evidence. So anyway, we'll see. But the important thing to me, yes, I would love to win, but also I didn't want this U.S. Senate primary to go by without progressive ideals and principles like Medicare for all, like a universal single-payer healthcare system, to not be discussed. And had I not been here, they would not have been discussed at all in this primary. So I'm very glad.
Yeah, I will say that I believe health-wise, that's made the biggest difference in Japan compared to the U.S. So I'm excited to talk about a little bit about the healthcare later as well.
Cool. Thank you. Hi, Jules. Welcome.
Hi, how are you today?
Good.
I'm from a little town called Moffat Beach in Australia, and I'm an ex-nurse, an ex-fashion entrepreneur, and also I'm now a business management educator and coach. So that's a bit of my background. We've had a great response in Australia. We've been very lucky about what's happened here. I think we're one of the forefronts in decreasing the virus in the world. Other than that, I'll let the others talk. Nice to meet you.
Nice to meet you, Jules. Thanks. Hi, Gertrude. Nice to meet you. Where are you from? What's going on?
Hi, so I'm Gertrude Kennedy. I'm based here in New Zealand. I've spent a lot of time overseas as well. I've been involved in LGBT activism and organising here in New Zealand and in Europe. I'm currently a public servant here in New Zealand as well. So it's been really great to be on the forefront of the government response here in New Zealand, which has been absolutely fantastic. And I have a bit of survivor's guilt about how good we have it, seeing what's happening in the US and the UK and in other countries as well.
Yeah, well, I really admire your boss. If you get a chance, tell her I think she's awesome.
We all think she's awesome too.
Very cool. Very cool. Well, welcome. Thanks, Gertrude. And I'm guessing, I'm not sure. Somebody's going to have to fill me in if the title is Reverend Pastor.
Reverend will do. No, just John will do. John will be fine. I live in London, UK. I'm British, and I used to be a doctor in specialty of infection. So it's been particularly interesting for me to see how the virus has been panning out. And in the UK, it has been pretty bad. We've got one of the worst death rates, I think third or fourth in the world at the moment. So, there's a few things I could say later about how people have been feeling about this whole ghastliness. But, things are on the way down. We're just starting to end lockdown, so to some small degree. So there's a lot of anxiety about a second wave.
Yeah, same here, especially here in Iowa, where in the state in which I live, we have a Republican governor who has basically reopened everything and lifted, I think, almost all restrictions, close to all restrictions. Bars opened up yesterday for the first time, and I literally driving here home, I had to take my cat to the vet, and when I was driving home an hour ago, I drove by patios. It's summertime here, it's 70 degrees out today. These patios are packed with people wall to wall, not wearing masks, just like nothing's wrong. And I live in Polk County, which is the capital, Des Moines, and we're the most populated county in the state of Iowa, and our cases just continue to climb. Like, they're not even on the way down, and our governor is opening things back up, pretending as though, I don't know what she's pretending. Anyway, we'll talk more about that later. Joseph, welcome. Tell us a little bit about who you are and where you are.
Hi, Kimberly. Thanks for having me. I'm actually from Iowa. I'm from Washington, which is, as you probably know, but maybe not all the people that have joined us from around the world, the capital seat of a county near Iowa City, which most people have heard of, or they imagine there's an Iowa City because of the name of the state. I live in Spain now, and I've been living here since about 2013, largely. I work mostly in LGBTQ organizing and the intersection with politics. And so we've been doing a lot of talks about how that's affecting people here in Europe, not so much for health reasons, but civil rights reasons. And I know that that's an issue in some parts of the States too, right now, that some leaders are trying to take this kind of crisis and take advantage to persecute people. And anyway, since I'm from Iowa, I'm really excited to join in this talk because I see like what my dad is going through, what my stepmom's going through, what my friends are going through. And while we've had it really hard here in Spain, particularly in Madrid, where I live, like we had a government that was taking it seriously and trying to protect as many people as possible. And so I just like worry about my loved ones there, seeing that the opposite is happening, you know, like you said, driving around, seeing people not being careful. So thanks so much for talking about this. I really think it's a vital thing to consider as we will be dealing with it for the rest of the campaign season and into, hopefully your time in the U.S. Senate to fix it. So thank you.
Yeah, well, yeah, I mean, my feeling based on reading a lot of things about it is that, well into 2021, unless suddenly there's this magical vaccine, right? A vaccine that suddenly is able to be produced, ramped up, that's effective, that doesn't have too many side effects, otherwise known as effects. other than the one you want, how fast that can come to market, and what happens with all of that, and then how effective governments continue to be in leading people and helping them stay safe, like not doing what we're doing in Iowa. Anyway, so we'll see. Thanks for being here. For the next person that I see, at least I don't know how you guys have everything configured, but the next person I see is Francesca.
Hi.
Hi.
I am British and I'm living in Singapore. So I'm an expat, and I think it's really important that I state that my experience here is very different from Singaporean locals. I've been living here since last July. I'm a teacher, so I've been doing e-learning for the past 2 months at home with my partner, who's also a teacher, and that's been interesting, doing classes at the same time in different rooms. We're about to end circuit breaker, as it's known here, on the 2nd of June. It's very strict in Singapore. You have to wear a mask as soon as you leave your front door, even like in the lifts going out of the front of condos. It's you get fined if you don't wear masks. It feels very, very strict, but that has meant that cases are far, far lower than the UK. So in a way, I feel very lucky to be here because I have never felt in any danger of catching the virus, which is incredible, really.
Yeah, that's great. I attended a protest here in Des Moines last night regarding the the murder of George Floyd in Minneapolis. And on the periphery, there was well over 1,000 people there, which for Des Moines is a lot of people to gather. So it was a good show of support. But on the periphery, you could stay at least 6 feet apart. But right up near where this kind of stage was and the speakers were, people were just shoulder to shoulder. I mean, the vast majority were wearing masks, so that was good. And it was outside in the sunlight. And, so I know that all kind of factors in and is helpful. But, if it had been me and it was not organizing the protest, I would have continually asked people to spread out. And so I'm worried about that. I'm worried about any time that people are gathering. It's incredibly critically important for us to gather and protest, but unfortunately, there wasn't, in my opinion, enough people saying, separate yourselves. You could do it. You could have done it voluntarily but I was speaking. So I kind of had to go down to that area where the people were kind of all shoulder to shoulder. Hopefully we all come out okay, knock on my wooden head. Anyway, so I think, let's see, we have, Tanya, welcome. Where are you and what's happening there?
Hi, thanks so much for having me. Yeah, I'm Tanya. I'm an environmental anthropologist who teaches at one of the universities down here in Australia. We haven't been quite as lucky as the Kiwis, but we've been relatively. It hasn't been as dramatic and tragic as it has been in other parts of the world, and I think we're all watching the States and the UK and Italy, have a little bit of that survivor's guilt. I think things closed down pretty quickly with us. Schools are just starting to open up. Friends of mine went to take a child to school the other day, and she had this mandatory temperature testing for all the children, and she had a temperature of 37.5, which is I would make my kids go to school if they had a temperature of 37.5. It's not high. They immediately had to go into lockdown and were tested. They were tested fast, free, and the tests came back very quickly. It was negative. And I'm very grateful to be somewhere where we have those kinds of resources and where the government is without question throwing resources like that at people to keep this pandemic in check. I think one of the bigger worries for us are some of the motions that are going through Parliament at the moment unchecked, because everybody is very, very distracted with what's happening here and overseas. So we had the Rio Tinto last week blew up a 45,000-year-old area of cultural significance in regional Australia, which has been absolutely devastating for our Indigenous people here. These sites can't be replaced. We can't protest. It just slipped through. There's a whole raft of environmental and other kind of policy decisions that are being pushed through quickly at the moment, and that's probably our bigger concern at the moment. So,
yeah, you mentioned rapid testing for anyone who like that child who had a fever or slight temperature, elevated temperature. And that's been one of the biggest problems with the response in the United States, is that we simply, even though we have something called the Defense Production Act, which allows the president to basically order private companies to manufacture things during a wartime, which they could invoke this Defense Production Act during this pandemic for sure. Our president hasn't done that and hasn't ordered these companies to now switch over and start manufacturing tests. We just don't have the scale of tests that we need. We just don't. And that's the whole secret. That's the secret to containing this pandemic, is you have to know who's infected and who's not. And contrary to what our own governor here in Iowa is telling people, just stay home if you don't feel well, that doesn't work, because you can feel and look 100% well and walk around infecting everyone around you, because depending on what study you're looking at, because it's all new, but I know in Iceland, they're determining roughly half of all people that are infected are 50% of people are infected and asymptomatic. In other words, no fever, no symptoms ever, not ever. They don't ever get sick. They don't ever feel sick, but they're carriers and they can transmit the virus. So if you can't test everyone and be able to quarantine people, you're dead in the water as far as being able to contain this thing. And then we have meat packing plants here in Iowa where the owners are letting people, I think they've now stopped it, work shoulder to shoulder with no PPE and nothing and not testing anyone. And so we've had these huge exponential explosions in the Latino and immigrant communities, because that's primarily who works in these meatpacking plants in Iowa. So yeah, we need to get the testing and the quarantining and the contact tracing and all of that ramped up, since that's all we can do, since we don't have a vaccine yet. So, Bonnie, where are you from? Where are you? Hi. Oops, unmute yourself, Bonnie. Hit your unmute.
Somebody had to do that.
Perfect.
Yes.
Sorry.
Yes. Hi. I'm an American, but I'm living in Canada right now temporarily. Actually, I have a home here in Newfoundland, Canada.
Oh, nice.
And we came just for a 2-week visit, but when the pandemic was officially declared and everything seemed chaotic and dangerous, we decided to stay. So we're staying now. We are reluctantly planning to go back to New Jersey next week. And really concerned about it, because here in Canada, at least in this part of Canada, the provincial governments have been very, very, very strict about the lockdown, the rules, and so on and so forth, and people are complying at a very, very high level. So we feel safe here, and we don't feel safe going home and being home in New Jersey. And even though New Jersey has a progressive governor and I think is really doing well, it still is a hot spot for the virus. And there's so many problems there that here it's quite different. Here the problems have to do, for example, with the fisheries. And fishermen are considered essential workers. So they are supposed to be working, and the question is, how can they manage safe distances while they're working? And the fish plant workers are, similar to the meat plant workers, are in a difficult position. But the Canadian government has ensured that huge amounts of money are provided to each one of the establishments for PPEs and other measures to help protect the workers. But this is a really big issue.
Yeah, it is. Well, I wish I could say something like, "Oh, it'll be fine coming back to New Jersey," but as you well know, New Jersey is one of the worst places, like next to New York. And I think a lot of that, even though I'm sure the governor in New York or New Jersey's and New York are doing their best, but just the density of people there is so hard to overcome. And literally, unless you're going to, especially in a city like New York City, I mean, unless you literally are going to lock people in their homes, that's almost what you have to do, because you can't even get out of your building, right, without touching elevator buttons. And I mean, it's just, it's very, very difficult. So,
that's being done in
come
places
home and stay in your house. Just come home and stay home, Bonnie.
Yeah, right. Well, that's what we will have to do that actually for 2 weeks, and then we live on a farm. So we're personally okay, but it's just very distressing to be in a situation where the leadership is frustrated by the reality of the magnitude of the problem, and then the federal leadership is just non-existent or perverse. Right. So it's a very, very disturbing thing, and it's just so nice to be here in Canada, where there's at least in this part of Canada, people seem to like the public health people who are constantly on the radio or on television telling what's going on and so forth. Everybody waits for the news, and everybody shares the news and so forth very excitedly, and new heroes have emerged. Yeah. And a little bit of that has happened in the States too. I know, Cuomo and so forth.
Yeah. I'm still waiting to hear that Dr. Fauci's been terminated from his employment, but every day I just wake up and I'm glad he's still managing to hang in there somehow. I don't know how he's doing it, but anyway, he needs to be elevated to sainthood just for dealing with the president on a daily basis during all of this. So I guess there's so many different aspects here that we could talk about. I guess the first one, on a more kind of micro level, is, and I'm not sure the best way to go about doing this, but for kind of basic income for those whose jobs have been either lost due to the pandemic, or their hours have been reduced, or they literally now don't have a way to make a living because of this, which falls, at least in the United States, and across a lot of different workplaces, but people like service people, like waiters, waitresses, people that worked maybe in a bar or a restaurant in any capacity, any of those kinds of things, people who worked in gyms, in recreational facilities, on and on, it's kind of course, the opposite for service workers in grocery stores, because they are essential and they've stayed open. That's a whole other thing. There's been sort of pandemics within Walmart, because Walmart evidently didn't do the best job, at least at first, of protecting their workers. What are in the places where you're all living? If you know, and if you don't, that's totally fine. I don't expect you guys to each know everything I'm going to ask, so no worries there. Do you know what's being done as far as, for instance, I'll share the American response. People got $1,200 one time. That's it. And if you're unemployed, so if you were laid off, right, if you're like a waitress or, waiter, one of those things I just mentioned, and you were laid off because of the pandemic, you can get unemployment benefits. And they did add federal money to state money so that you would get $600 a week for your unemployment benefits. So, and then the one-time $1,200 payment that went out, I think, last month. And that's it. Now, $1,200 doesn't even last a family a couple of weeks. It could even maybe last you a week, depending on where you live and how expensive your housing is, in the United States. So that's that. And then as far as micro businesses, like really small businesses, we had something called PPP, Paycheck Protection Program. I can't remember the last P program, I think it was. But what happened there was kind of larger small businesses came in and applied for all this funding because you had to go apply for it, and then it had to be processed through banks and so forth. And by the time a lot of mom and pop businesses even got their applications in, all the money was gone. So that's what happened here. I've talked to numerous small business owners here in Des Moines who like people that own like coffee shops, like little cafes and things like that, who applied for PPE and were told it was all gone. And they didn't lollygag around and wait to apply. They applied, as soon as they could. So small business owners, especially what I refer to as micro business owners, because small business, according to government, that can be a multi-million-dollar business. I don't know if that's the same in every nation, but for the purposes of the United States government, small business could be a $10 million a year business. I don't know where their cutoff is with revenue or size of employees, but so that's why I say micro business, just because to me that's talking about more of maybe you've got 10, 20 employees at most, and then you also work in the business as the owner, that kind of a business, which we have a lot of in rural Iowa, especially. So for those of you who don't know, Iowa is by population a very urban state, which surprises some people. So meaning the vast majority of our people live in cities, not huge cities, but cities of anywhere from 200,000 to 500,000 people in a metro area. We've got a handful of those cities with 500,000 people in those general vicinities. And then the majority of our state by geography is very, very rural and big and very agricultural. So it's kind of a very interesting mix of how our population is spread around as far as density. We've got a lot of dense areas and then a lot of a vast area that is very sparsely populated. And I can tell you it's a big state because from June through March, June last year of March this year, I put about 40,000 miles on my car just driving around the state of Iowa to talk with voters. Anyway, so that was a lot. Tanya. Yes, Tanya, what did you want to comment?
Oh, I had my hand up. Sorry. I forgot to take it down again. Sorry. No, I was just, you were talking about having lockdown in New York City, and one of my tutors is from South Africa, and that's precisely what they're doing. People have been locked in their homes. They haven't been allowed out to walk the dog for any reason really, other than to get supplies. They've stopped alcohol and cigarette sales entirely. And they're doing great as well. So yeah, that was just a comment really.
Good. Lauren, what did you want to comment?
So interestingly, I think we're talking about how the universal income or something like that works. So it's quite interesting to me that, and I think this points out the bigger holes in the American system. I think most governments have struggled with how to get money out to individuals. Japan is offering 100,000 yen, basically $1,000 per member of your household, but it's been kind of slow to roll out. But actually what they did in Japan was first offer a lot of support to business. So small businesses, medium-sized, large businesses, we are seeing increased unemployment, but actually a lot of businesses were able to access funds to keep staff. So that's one piece of it. But what I think is interesting in Japan is even though the personal money has been slow to roll out and the businesses had to go through lots of hoops to get money, they were able to access it pretty quickly. But the rest of the safety net is what makes it less dramatically disastrous here. So, the number of people that declared bankruptcy in Japan last year paying for medical expenses was 0. So it's impossible to go bankrupt in Japan because of your medical expenses. You will be taken care of. There is so much funding to help people when they're sick. And there's lots of other legislation that supports workers over companies. So the companies have to be a lot more careful about how they protect their workers because most of the law in Japan, most of the safety net and the law in Japan benefits the laborers, not the CEOs and not the companies. So what I think is so interesting is, and I hope we have a chance to talk a little bit about healthcare about this later. What I think is so interesting is that it's the infrastructure of the U.S., the psychological, sociological, medical worker infrastructure that is why you guys are at the top of the list of all the worst parts of COVID. It isn't the disease that's affecting all of us, and it isn't the difficulty. Like some of this bureaucratic systems are hard to roll out anywhere. I don't think any country has had a perfect response, but I think what we're seeing is that the very way that things are set up are very detrimental to the middle class and anyone below middle class in the US. And this is contributing to a higher death, less testing, like a million other things. And so I hope that the only bright side I can see coming out of this is a lot of substantive discussion about those things and what it means. Like, it's easy to say there's systemic health conditions in the, communities of color, but now we see what that looks like in a global pandemic. Right. So I would just say, like, Japan has struggled with a lot of things, but our mortality rate is extremely low, and people are not, going to starve or lose their homes here because there's other safety nets in place to make sure that we can weather this storm.
Yeah, exactly. I mean, if anything good comes out of this horrific pandemic, I hope that in the United States, it's that we finally start understanding that your job and your health care should never be tied to one another, because we have so many more people now unemployed who now are being told, well, you can pay COBRA. You guys are probably going, what the heck is that? COBRA that's an acronym for, I don't even know what it stands for. It basically means if you lose your job, you can just pay, like, out of pocket to keep your insurance going for another, I think it's 6 months. But it's super expensive. It's like a couple $1,000 a month. So it's like, oh, you lose your job. Well, you can do COBRA and keep it for another 6 months, but you don't have a job now, so you can't do it. It's absolutely mind-blowing. But I do believe things are going to shift toward a Medicare for all system similar to Canada's. But it's going to be literally a tooth and nail fight against the big money of that is in our elections here in the United States, that essentially is able to buy politicians. And I don't mean that in the criminal sense. I just mean that in the, unfortunately, legal sense, in that they're allowed to contribute thousands upon hundreds of thousands of dollars to election campaigns. And so then, of course, those politicians owe those corporations something. And those corporations are going to have their calls answered by those politicians. And so that's got to change, which is all going to be very difficult. John, what did you want to say?
I think in the UK, the handling of the finances for people getting money from the government has been one of the better things that's happened, in that for private sector, you get up to £2,500. That's what, $3,800 a month, up to, depending on your initial salary. And there are other support for people who are self-employed and so on and so on. I won't go into detail, but actually most people have been pretty impressed by the funding in the UK but of course there are some groups, the 0 hours workers and others, on virtually nothing, who have to apply for our standard systems, something called universal credit, which is, like support funds, and then people who run pubs and restaurants, like all over the world, are just in a dire situation because they're still having to pay rates and so on. But overall, and also, of course, in the UK, you don't have to pay for the National Health Service treatments. Obviously, you pay through taxes, but that's a big relief to many people. Any testing, any intensive care, everything, you don't have to pay. So that's a big deal, I think, for people worried about getting sick.
Yeah, absolutely. I mean, I was reading an article from The Guardian about a couple of weeks ago. It came out and it had an interview with an American emergency room doctor. I think he was working in New York City, actually, but then it also went into some statistics. And one of the things that just jumped off the page at me was that it said, it was in the last year or so, this poll was done, or poll, I guess would be more of a poll. About 40% of Americans were seriously afraid of their medical bills, and only 30% of Americans were seriously afraid, or were afraid of getting seriously ill. So 30% of Americans were afraid of getting seriously ill. 40% of Americans were afraid of the medical bills more than afraid of getting seriously ill. And that is the weight and the emotional and mental toll that, you know, when those studies come out every few years ranking the happiest nations, out of developed nations, what are that sort of happiest nations? The United States is consistently ranked very low among all developed nations. And I firmly believe that one of the main reasons is because we all quite literally live in fear that either we are going to get very ill, or our child or our loved one or our parents or somebody, and they're going to either simply not going to go to the doctor because they're afraid of the amount they're going to have to pay out of pocket, or they're just not insured. They don't have insurance because they can't afford the ridiculous premium costs to begin with. For those of you who don't know, the last time that I paid my own insurance on my own, I'm thankfully now on my domestic partner, my fiance's insurance, and we are very much an outlier. I think we pay something around $300 a month for both of us, which is very low. He's a software engineer. He works for a bigger company, so we've got a phenomenal deal. But we still have like a $1,500 a year deductible. So if I go to the doctor, I still have to rack up over $1,000 a year, even though we have Cadillac top-notch insurance for somebody in the U.S. I'm still going to have to make a co-payment at the point of service at the doctor's office. And then if I need any testing or anything, I'm going to have to pay cash until I hit over that $1,500. And $1,500 is low. A lot of insurance plans have $5,000 and $10,000 deductibles. So you're paying every month. When I last paid my own insurance individually, it was about $800 a month for just me, along with that $1,500 deductible. And that is low as well. That's kind of low. I think most families that are paying 100% of their own, it's a couple $1,000s a month for an insurance plan that still has a deductible. So people don't understand that Americans are often paying over $10,000 a year, basically, just for their medical premiums and deductible, not for anything else, not if they get hospitalized and then they also have more on top of that. This is just for very basic stuff. So people, me included, put off going to the doctor. Well, it's probably fine. You know, I don't want to take the risk of incurring the cost. And then we wonder why our life expectancy is declining the last few years in relation to, say, Canada. So yeah, it's all a huge issue. And I think that, that emotional and mental toll, of always having that fear in the back of your head about being able to afford it, and then what if you do get really, really sick, is one of the major reasons why America has that low level of happiness, because we're all justifiably stressed out about that and a lot of other things about the way things are done structurally in our country. Joseph, what did you want to say? I'm just going to go through and call on the hand-raised people.
Sure. Yeah, I was just going to go back to your question about the economic response here. We had in Spain the strictest lockdown in all of Europe. I don't want to say stricter than, like the Wuhan area in China, but as far as Europe, we had the strictest lockdown, even stricter than Italy. And so obviously that has some big economic consequences that come along with it. And what I would say is the great thing about living in Spain right now is that we have a progressive government. And so even though there weren't necessarily all the systems in existence when this started to help people that needed it, that they actually made an effort to figure out who needed money and how to get it to them. And so like going down the list that you mentioned of the things in the US, we did not get a stimulus payment, but again, that I think is because there's this idea that everybody that needs something is getting it, and to use the money where you can. And Spain, since it's in the EU, they can't just print more euros, so it's a little more complicated. But yeah, that would be great if they could. But if you're watching the Netflix show like Money Heist, they can only print so many euros here. It's only what's allowed by the European Central Bank. So
yeah, a lot of people, Joseph, a lot of people who are not American may not understand this, and maybe this is true of other countries. I certainly am know nothing really about international monetary systems, but the United States federal government, not the states, but the federal government, we always have these arguments about how are we going to pay for it. So if you're an American and you listen to political arguments about why we should have this policy or why we can't have that policy, the refrain from the Republican Party, the more conservative party, is always, we can't afford that. How are we going to pay for it? How are we going to pay for it? How are we going to pay for it? But they always find ways to pay for an increase in our military budget and to go to war and to give tax cuts to wealthy corporations. Those things have all happened in the last 3 years under this administration. And nobody ever asked, meaning none of the Republicans ever ask, how are we going to pay? Thing to think about, but it is actually true that if the United States wants to pay for something, they just do it. They literally can just make more money. And so all of this nonsense about we can't afford it in the United States is just that. It's nonsense. On a federal level, we can pretty much afford anything we want to afford within, and that there's a whole other show we could have about the debt and the deficit and all that. But in the short term, they could certainly do whatever they want.
For sure. In that sense, Spain is kind of like Iowa. We can only spend what we have from our economy, whereas the European Commission could decide to print, the central bank could print more money and then Spain would have it. And that's something that they're talking about because, the idea that you wouldn't help the states in the United States is crazy. And the same thing here. So they're talking about passing 750 billion euros to help Spain and Italy and the other countries in the Eurozone that need it. And that's just so basically obvious to me, but politicians, I guess. But here the unemployment is a really good system for the people that have a regulated job. So if you're laid off, you get a percentage of your income that's really high compared to what I know some people get in other countries. And so, even if the wages in Spain are maybe lower, you're getting 80% of what you were making. So you can usually make things work. Also here, because again, we have this progressive government, last year they started a new program to create an unemployment system for self-employed people. So that includes people that are contractors. So if you're a journalist and you're writing articles for lots of different publications, that would be you. If you opened your own little coffee shop, that would be you. So it also includes a lot of small businesses. And so luckily that system already existed. And then what they did here was anybody that was in an industry, even if you're a self-proprietor, mom and pop thing, if you had to close because you own a coffee shop and now you can't let people come into your coffee shop, then you immediately got the self-employment unemployment. And then if you were in an industry where maybe you're a journalist, so in theory you could sit at home and write an article, but if you work for a travel magazine that now, there's no travel, so they're not going to be contracting you, then you could show from what you were making in February to what you were making in March that, I lost 70% of I think it was 70% was the level of your income. And then you also got the COVID-19 self-employment unemployment. So they took existing systems that again are relatively new because we have a new progressive government and then made them better. There's nothing really quite like the PPP system here because if your employees are still working, there's the idea that the company would still pay their wages. But if you choose to put them on a furlough, then the government has a lot of systems to help cover their wages, even at a higher rate than unemployment, because the idea is you keep the relationship between the the production and the business and all that stuff. I'm not an economist, but it's a better deal for both the business and for the worker. And then the big huge thing here was something that happened is essentially because of the crisis. And so in a lot of places, I think it was in Australia, maybe Tanya, you mentioned unchecked government measures that have happened. Well, luckily we have a good government. And so that's why voting is so important because they're using the crisis not to do anything in my opinion, too far. It's just what should have already existed, but they're using this crisis to make it happen faster. So when they had the election, they talked about having a universal well, not universal, but like a vital minimum income. So for the families that don't have work and maybe they've exhausted their unemployment benefits, that they would still have a basic income. And so that's something that is starting at the beginning of June here, that everybody that doesn't have an income, whether that's, from any source, as I understand it, they get a minimum payment. And that ranges from 400 euros a month to 1,000, which doesn't sound like a lot, but actually for most parts of Spain, that would like pay for everything that a family of up to 3 adults and 4 kids would need, especially if they own their own home. And there's other systems to help people that need rental assistance. So the cool thing here is that even though we maybe weren't in a perfect situation to start, Sweden or wherever we imagine that everything's great, the government took a lot of steps to find a way to help everybody. And it's really just like having healthcare that you just go to the doctor and it's free. You can just let that part of your anxiety go.
Awesome. That's fantastic. Bonnie, did you have a comment?
Yeah, yes, I do quickly. I'll have to go in a minute, but this will be quick. But for Canada, a program was created right away called the Emergency Response Benefit Program. So every person who lost a job or who's making less than $1,000 a month is eligible for $2,000 a month. And then this is coordinated with the employment insurance program. There will be kind of a top up for who are eligible for unemployment insurance. They will get an additional amount through this other program. And this has really been a boon to people, certainly out here in the remote areas of Newfoundland, because this is a substantial amount of money given the general level of income here. So it's really extraordinary to see how many people are benefiting from this. And there's discussion now about extending it because obviously this is not going away, and so something has to happen. And the other thing is that there is a lot of attention given to what you're calling the micro businesses. The problems are humongous, and tourism is a big problem for this area as many others. And so lots of small, places and so forth, and boats that take tourists out are in terrible. So there's now a grant program that is giving people money outright instead of trying to avoid giving them loans, but actually just giving them money to help keep them afloat, improve. So anyway, there's a lot else going on, but it's that kind of thing that's impressive.
That's fantastic. Yeah. I think there's been proposed legislation in the United States to start a similar program that I think was mentioned about Spain, where they're trying to just keep the money going to the business owners, provided that they pay their employees with it, so that also helps the financial aspect of the business to stay afloat through this pandemic so they can come out on the other side. And that's important. I don't think we're going to pass it, but somebody's thought of it. Jules, what did you want to comment?
Well, I'm actually an international business lecturer, and in Australia we have a massive market. One of our biggest industries is international students. There's 500,000 international students in Australia. So in my particular area, the company I worked for had 7 different campuses, and most of us actually lost our contracts. So we are all on a thing called JobKeeper, which is for micro businesses to survive during coronavirus. I'm not sure where it's going to go because our international borders are not going to open up very quickly, and they've been pretty strict about our international borders. So there's a lot of really high intelligent lecturers in Australia that have no jobs. So that's of interest, and I'm sure that's all around the world. Yep, and we also have a system here for all of the other people who are unemployed, which is called Job Seeker. So we've got Job Seeker for the unemployed and Job Keeper for businesses. So I think the government has done a really good job of protecting the individuals in different circumstances. The question is, how long are they going to continue that support? Yeah, so interesting.
Yeah. Yeah. Do you know what is happening with childcare? You know, like, for example, like I mentioned, here in the U.S., we're estimated that we're going to lose a third to a half of all of our childcare spots through this pandemic. What do you know, Jules, about what's being done in regards to childcare? And I guess briefly, if you know, is there already like a federal a national childcare like subsidy, or do people typically get help paying for childcare when they have children in Australia, or no?
Yeah, they do get help for paying for childcare. We immediately, when this happened, the Prime Minister actually announced that there would be free childcare for a number of months, which is, I think, about to end. So we've had great support within the childcare sector, and in fact, all of the people in the childcare sector have kept their jobs.
Wow. That is like the total opposite of what's happening here. That's fantastic. And that's what should happen. That's awesome.
Yeah.
Oh,
that's my understanding. I've got a few friends that work in childcare and they're all working, and there's been no problems with their work. So the government's really trying here to keep jobs with the JobKeeper. So basically people are going to work and being paid JobKeeper by their employers, and they're still paying tax on the JobKeeper. So it's $1,500 a fortnight, which is a reasonable amount. I mean, it's not a huge amount. You have to, in order to qualify, you have to have lost 30% of your income. So you can still actually work in a second job. But yeah, so it's a good scheme, but it needs to continue because there's going to be a lot of people who are not going to actually go back to their traditional role straight away.
Right. Yeah. Well, thanks. Gertrude, did you have something you wanted to say?
Yes, I did. So when our government first announced a COVID-19 response, they announced a $20 billion fund in order to do it. That's quite a lot for us. That's about 4% of our GDP. We're quite a small country.
Yeah.
So that was really, really big. And that included a wage subsidy. So any business that had lost 30% of their income could qualify. And so that has kept staff in a job up until now, and that is actually continuing up until the end of June, and I think it's going to continue past that as well, because people just aren't getting. So some businesses have folded, and that includes service staff. So that was waitresses, baristas, bartenders, and we are actually reopening at the moment because we can safely do so. I actually spent Friday night out with a friend, and it was completely normal because we've had the correct response and we can go back to have normal lives. Like wearing a mask in public is actually quite rare, but we do have to sign in on like 18 different contact tracing apps in order to do it. But with childcare in New Zealand, we have 20 hours free for every child, and childcare centres opened under level 3. So we've got 4 levels. Like 4 was complete lockdown, 3 was partial lockdown. They started to reopen then with so many safety precautions, and that's not something that we've really had to worry about in terms of childcare. It's been something that's really accessible and will continue to be accessible in New Zealand, and I'm really proud to be in a country that cares about people in that way.
Yeah, that's awesome. There was an article in the New York Times last year called "Why Does America Hate Its Children?" You should Google it. You can read some of the statistics in there. Like most developed nations spend 2 to 3% of GDP on programs for families and children, specifically aimed at children. The U.S. spends 0.6% of its GDP on programs for families and children. And as I don't know if you all know, but I've been primarily an attorney for kids and parents in juvenile court for the last 20 years. So that's of particular interest to me because I've represented children for so long that I'd love to get to a position to be able to change that. Let's see. Let's see if there's anything else I wanted to ask about before we kind of do I guess we're doing a lightning round. How exciting. I think we've covered just about all of that. So you're essential workers, and I will just sort of go down the list from just, again, I don't know what you all see, but from my left to right, I'm just going to call on people. Gertrude, I think you're going to be first. Have your essential workers, if you know, been paid additional, like been paid a bonus or hazard pay or whatever you're calling it, if anything, in your country? Like people like medical professionals, like people working in grocery stores who had to keep working, people who are delivering the mail, whoever they are?
Yeah, so in terms of like, I guess, postal workers and other sort of government employees, not so much, but they were protected from losing their jobs. Initially, they weren't given the wage subsidy, and then the government basically guilt-tripped agencies into paying them and applying for the wage subsidy. But also supermarket workers under level 4, so our 4 levels, level 4 was complete lockdown. That was like eliminated. It was really, really strict. They did receive hazard pay, which stopped immediately as New Zealand went into level 3, and a lot of Kiwis, we actually support that continuing because they've worked so hard. Those staff members, some of them were assaulted, some of them had people cough on them, which they were then jailed for. So they've actually dealt with so much during that time that we totally want them to not only keep receiving a living wage, but they deserve a living wage because they've always been essential workers.
Right, exactly. We're having that same conversation, except that our government leaders don't tend to, at least the predominantly party in power doesn't tend to believe that, but that's what some of us who are more progressive are saying. Well, if all these people were essential all this time, then why are they making $10 an hour in the wealthiest nation on earth, right? John, what about in your area? Do you know if the essential workers were getting any additional pay or?
Not at the moment, but I believe that at the end of the year they will get quite NHS workers the health service workers will get additional bonus of some kind. I've read that it's about 40%, but I'm not 100% sure. Private companies have been giving bonuses, but it's a bit hit and miss, really. It's not driven by government. And one thing is that a lot of key workers and essential workers, like in the health service, have been flooded with gifts from local businesses, hampers of food and drink and all sorts. But so that's as far as I know. I'm not too sure about some other workers.
John, I have another question. Do you feel like the response to the pandemic has been sort of very politicized there, and or do you feel like it's just more been everybody pulling together? Just because, for those of you who you probably all know this, but it's been incredibly politicized here, incredibly politicized, rather than just caring for everyone's health. It's been really politicized.
Yeah. I think the mantra from the politicians has been that everything has been driven by the science, by the scientific advisors, chief medical officer, and a few others. But people do perceive that there has been sort of political influence on certain stages, like the current relief of lockdown to some extent is more a political act, and some advisors are concerned it's too early and that it was really there's discussion about it. But I think overall it's not been as politicized as the US, but I don't think that would be possible, really, would it?
No. It wouldn't. It would not be possible. I think we win the prize for the most politicized response to the pandemic and listening to science the least. Like I said, thank God for Dr. Anthony Fauci, who's been like the only very high level person who's been giving us good advice and has even stuck his neck out a few times publicly and disagreed with the policies and statements of the president. That's why I'm just wondering how he's still there. But maybe the advisors to the president realize that if they fired the only person talking sense, that the dominoes would continue to tumble even harder, and it would be bad for his reelection. Joseph, what about are essential workers paid a bonus there, and how do you sense the politicization of the response has been in Spain or not?
The first part of the question is so easy to answer, and the second one is so complicated, so maybe I shouldn't.
Yeah.
There's not any essential worker bonuses that are mandated by the government, nor are the public healthcare workers being paid extra. And I do think that's something that maybe now that we're coming out of a very difficult time where there hasn't been the space to talk about that it'll come up. because like I have friends that are doctors and they're just like, they just can't do it anymore. Like I have a good friend who's a radiologist who'll probably quit his job at the hospital at the start of July just because he like they're not going to like give him a normal vacation because they don't have the money and he can't do it. So it's a big problem, and I think it's something that will be addressed soon. That said, like the inequality in Spain is less than in the United States. It's still too high, but like the essential workers that now we're learning are essential are not paid as poorly compared to the rest of us as maybe in the United States, and particularly in Iowa, where you would know the minimum wage. I would prefer not to think about it, but
for those of you who don't know, $7.25 an hour is the minimum wage in the United States of America. Now, some states have overridden that and have a little bit higher, but we're just trying to get a $15 an hour minimum wage in the U.S. federally, and that's like fighting, like, pulling teeth. So,
and that's shameful, obviously. As somebody who sees like what you can have in a society that takes care of everybody day to day. And then as far as the politicization, that has definitely been a big thing that has started here because Spain is a very complicated country in the way that the constitution is written and who has what powers. So just to be very brief, because people don't have time to know this about every country in the world, but like in Spain, Madrid, for example, is an autonomous community. Catalonia, which people read about in the news, is another autonomous community, and there are many, many autonomous communities, and each one has provinces, et cetera, et cetera. So normally things like healthcare is organized on the community or like state, we would think of it in the US basis. So like the Madrid government is in charge of the healthcare system in Madrid, not the national government, even though they would pass laws that would tell Madrid what to do, but then they have to implement it. And so as we've gone into the de-escalation of our lockdown, which, like this week, we could go to dinner at somebody else's house because we've done such a good job. Like Iowa has more new coronavirus cases than Spain. And there's, 2.some million, 3 million maybe in Iowa, in some cities, but Madrid, they're much more denser, and there's 40 million something of us. So anyway, like we're doing really well, but now that we go into the de-escalation, the national government is trying to tell the regions when they can go from phase to phase. We have 4 phases like New Zealand. I think our numbering system is the opposite, but like we were in phase 0, now in Madrid we're in phase 1, but other parts of Spain are in phase 2, and then some islands are in phase 3. And so there's a lot of fighting amongst the different levels of power to say like Madrid should be going to the next phase because we need to get the economy going. So there is that talk, but thus far, luckily, the national government has won out, and they're the ones that are most worried in large part, there's some good regions too, but in large part about health as opposed to opening too soon. So there's a lot of like protests here, but it's like people banging on their balcony with a pan, which is, relatively harmless.
Relatively innocuous. Yeah, exactly. We actually had like little mini riots in Des Moines last night. So there you go. You never thought you'd see that. So let's see. So politicized response and have essential workers been paid a bonus. Jules, do you know about either of those things?
I know that there's a lot of the big supermarkets have paid their staff a bonus of $750. So that's Coles and Woolworths, which are our 2 biggest supermarkets. The government has paid some essential care workers and full-time home care workers $800 and $600 per quarter for 2 quarters. Other than that, I don't think that there's been much more. In terms of the politicisation, we have states like you do in America, and there is a bit of a fight at the moment about who should open boundaries, who can go between which state and what other state. The state we live in is very low with the coronavirus cases, and the head of the state doesn't want to open our borders, but the other states want to have those borders opened so that they can actually access our our state and increase coming into our state through tourism and other ventures. So there's a little bit of fighting going on between states. In fact, there's been someone's put some things into the High Court about forcing people to open boundaries. In terms of the federal government, though, I think they've been pretty good and they've really worked together to try and keep this not a political agenda, which has been fantastic. Yep. I can't hear you, actually.
You're muted.
Oh, sorry. Lauren, what about hazard pay and politicization? Doesn't sound like a whole lot of politicization going on there.
Yeah, so for hazard pay, we have a pretty good standard of living. And like I said, they have tried really hard to keep people in their jobs. And because of the medical safety net and very proactive medicine, I think people are a little less stressed about that. They haven't offered a lot of like bonuses or hazard pay, but we have a bonus system anyway, which would kind of come into effect at the end of the year. So we expect that a lot of essential workers will get some kind of bonus for this time period. But actually there has been some politicization in Japan, just that our Prime Minister, Abe, who has been the longest serving Prime Minister in recent history, is under attack for kind of perceived issues. I think they've done a decent job, but some of his, the optics haven't been as good as they could be. And also some of the programs were slow to roll out by Japan standards. I don't think by US standards, but by Japan standards. So in that way, it's given some power to his opposition. But up until now, it's been pretty strong. And we have very strong regional governors, and they have been doing very well. So actually the popularity of a lot of the regional governors has been going up, up, up. And the federal government's response has come under question. But Japan kind of moves as a block. We're a very homogeneous society. So if one regional governor was doing something good, everyone else would start doing it too. So in that way, very uniform.
Cool. Francesca, do you know about essential workers and what's the politicization, in your opinion, of response there?
I don't feel entirely comfortable commenting, just because my experience as an expat, only having lived here for 10 months, is very, very different. And I feel hugely privileged that, you know, I'm on a 3-year contract here, I'm getting paid regardless, health insurance would be covered. And that is very, very different from obviously Singaporean residents. I was just desperately trying to Google some answers. So you could probably find better ones than me. But there have been payouts for Singaporean residents. I know that, just kind of $600. There was one in April, and I think there was another one. In terms of essential workers, I haven't found anything concrete. I think they're trying to say we want to thank people in a tangible way, those people who are continuing to work. But I actually don't know anything concrete. And then in terms of the kind of political situation, my head is so much more in British politics, I have to confess, than here. So I open my BBC and my Guardian apps before I open the Straits Times, because that's where my heart is back home, really. And yeah, again, I'm not really affected by political decisions here. So I'm sorry, it's not a great answer, but that's... it's pretty much all covered. The interesting thing about 6 away, basically, never to be, well, I hope, seen again. Actually, I have to say the fatalities here, we've had 33,000 cases, I think, and only 23 fatalities, which is quite extraordinary. But the main reason for that is that most of the cases are in the foreign worker dormitories. I don't know how much people have read about that, but in terms of community cases, it's very, very low. So like if you go to buy your milk and cornflakes, the chances of being infected are really, really minimal. But the cases, there are kind of still 700 new cases every single day from these foreign worker dormitories, and their standards of living is terrible, and so it's just spread. But the numbers that keep coming through is because they are all being tested. So I think it's just going to go through the whole population, which is, I think, 20,000. Could well be wrong. I think could be more than that. But yeah, the high cases are predominantly from that area rather than spread out across Singapore.
Got it. Gertrude, what do you know if there's bonuses, or did I already ask you? I'm thinking I already asked you this.
You have already asked me that, yeah.
I thought so. They're like, it's playing like shuffling above on my screen. So I was going like this, and now everyone's in a different spot. Okay, anyway, so Tanya, I don't think I asked you those questions yet. I know you're in the same country as someone else, but did you have anything different or anything to add about the hazard pay, and then just your impressions of the how political this is being made there?
No, not really. I think Jules has covered, our situation. I'm doing some research on supermarket employees at the moment, and I think one of the things that's emerged from that is that while I think traditionally supermarket workers have been not considered particularly higher status, there's been a real shift in the sense of value of those workers. So there's been a real emotional kind of, buoyancy, I think, which has been quite interesting. Like, people have felt really good about themselves and their role in responding to the pandemic. So that's been pretty amazing. So along with some, the horror stories as well. But I think it'll be interesting to watch how we treat certain of our essential workers in the coming years. And I agree with Jules. I don't think it's been particularly politicized. But I think, Kimberly, coming back to what you were saying earlier about healthcare, and it keeps coming back to this question of healthcare. It's very difficult to unravel, to tease apart this question of healthcare and economy and everything else when, everybody who's not in the States, I think, feel like we can get sick and go to the doctor and get treated and not be, put in an enormous financial hole for the rest of our lives. I'm extremely fond of the United States and have spent, have lived there before I had children. I wouldn't even consider living there precisely because I have no confidence that I could keep my children safe, that they would be treated if they got sick. Let alone in a pandemic. And that seems to be the key difference here is the healthcare. It's just non-existent. It's quite terrifying to watch, to be honest.
Yeah, it is. We did a panel on just healthcare where we had an American who's now living in Canada, and I think she's married to a Canadian, whatever. Anyway, she's been there for a number of years, so she has the same access to the Canadian healthcare system as a Canadian-born citizen would have. And then somebody who was living in France, and somebody who is American but has lived in the UK, and so we did a whole hour and a half discussion of that, and how it just literally blows the minds of people who are not American to hear what the financial repercussions of getting sick in the wealthiest nation on earth are. So yeah, that's it's just amazing. But again, we have a priority problem, and in our campaign, we keep saying we're putting people over profits, and when you do that, you have plenty of profits plus your people are happier and healthier. But that doesn't seem to be something that at least Republican and many Democrats in the United States don't seem to understand yet, is that when you prioritize people and you make sure your people are well and happy and healthy to the extent you can by things like universal medical care, that actually will make you have a far healthier nation in general and happier nation in general, and including mental health care, which is sorely lacking in the United States and often is not included in your medical care plan, even if you purchase insurance. So you literally have no way to see a mental health professional. A lot of people don't unless they pay out of pocket. And it's typically expensive. If you're very, very poor, you may be able to find like a nonprofit entity where you can see a therapist, like on a sliding scale for less money or whatever, but it's just horrible. And the currently proposed Medicare for All plan in the US also includes mental health treatment and a lot of other things. So hearing aids are not typically included right now in Medicare. Dental care is typically not included in most people's healthcare insurance, even if they have private insurance. So that's a huge other expense. So yeah, anyway, Well, we're going to wrap it up. We've gone over an hour. We could have gone like 10 hours because there's so many interesting things. And I just appreciate you all being here. And for some of you staying up in the middle of the night, I think, or depending on, the Spain, the UK, London person. Yes, John, you guys are like up super late. Thank you for staying up so late to be here. You can go to bed now. But thank you all so much, so much for participating in this panel. I'm sure that the people that view this, because it'll be a recording that people can access on our website as well as our Facebook page, are going to find it very fascinating, very informative, and I hope very motivating. By that, I mean for Americans to understand that it is not this way in most parts of the world and that we can do better. We just have to start electing different people into positions of power in the United States. So thank you so much, everyone. Have a good night or good day if you're in New Zealand or Australia. See you all later.
Thank you for inviting us. It was
Thank
great.
you. Thank you so much. Stay well, everybody.
My family and friends are voting for you too.
Bye. Our healthcare should work like it does in a lot of other wealthy, developed capitalist countries where it works like a public library. We all decide we're going to invest in libraries, right? They're important. We all pay for them. They're not free. We have to pay the librarian, the books, the building. But when you walk into a library, you just hand them your library card and you leave with a book. You don't pay anything at that time of service and you never get a bill and you sure as heck never go bankrupt. And that is what healthcare needs to look like in the United States of America.